Sleep apnea diagnosis and CPAP treatment. Sleep apnea is a common obstructive sleep disorder characterized by recurrent hypoxia and hypercapnia, managed primarily with CPAP therapy. Overview. Sleep apnea is a common obstructive sleep disorder characterized by recurrent hypoxia and hypercapnia. It is classified into two main types, obstructive, OSA, and central sleep apnea, CSA. Obstructive sleep apnea is more prevalent, accounting for approximately 90% of all cases, and is often associated with obesity, anatomical abnormalities, or neuromuscular dysfunction. Pathophysiology/mechanism of action. The primary mechanism of sleep apnea involves the collapse of the upper airway during sleep, leading to reduced airflow and increased intrathoracic pressure. This results in hypoxemia, low oxygen levels, and hypercapnia, high carbon dioxide levels, which can lead to disrupted sleep, daytime hypersomnolence, and cardiovascular complications. The obstructive mechanism is primarily due to the relaxation of the pharyngeal musculature, which causes the airway to narrow or close. The central mechanism involves the failure of the brain to send appropriate signals to the respiratory system, leading to reduced ventilation and increased CO2 retention. Clinical features/indications. Patients with sleep apnea typically present with excessive daytime sleepiness, snoring, and gasping during sleep. Other common symptoms include nocturia, hypertension, and cognitive impairment. The primary indications for diagnosis include the presence of persistent hypoxia, hypercapnia, or significant daytime sleepiness. Diagnosis/monitoring. Diagnosis of sleep apnea is typically performed using a polysomnography, PSG, which is the gold standard. PSG evaluates sleep stages, oxygen saturation, and respiratory effort. For patients with suspected OSA, a home sleep apnea test, HSAT, may be used as an alternative, though it lacks the precision of PSG. Diagnostic criteria include a respiratory quotient, RQ, greater than 1.0, a respiratory effort index, REI, greater than 1.0, or a sleep apnea hypopnea index, SAHI, greater than or equal to 15 events per hour. Oxygen saturation should be less than 90% during sleep, and the presence of daytime sleepiness or hypoxemia is also important. Treatment/management. The primary treatment for obstructive sleep apnea is continuous positive airway pressure, CPAP, therapy. CPAP involves the delivery of a constant pressure airstream through a mask, keeping the airway open during sleep. The recommended CPAP pressure is 10 to 15 centimeters H2O, with adjustments based on patient tolerance and anatomical factors. In addition to CPAP, lifestyle modifications such as weight loss, avoidance of alcohol and sedatives, and positional changes are essential. For patients with central sleep apnea, treatment may involve bilevel positive airway pressure, bilevel BPAP, or nocturnal oxygen therapy. In severe cases, surgical intervention or adaptive retinal therapy may be considered. Key clinical points. Key points. CPAP is the first-line treatment for obstructive sleep apnea and is associated with significant improvements in sleep quality and cardiovascular outcomes. Diagnostic tools such as PSG and HSAT are critical for accurate assessment and monitoring. Patient compliance and adherence to treatment are key factors in successful management. Multidisciplinary approaches, including sleep medicine and pulmonary medicine, are essential for optimal care. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.